Hi everybody, and welcome to our module on evidence-based medicine. Evidence-based medicine refers to caring for patients using the best available research from the medical literature. And if you're going to take care of your patients using evidence-based medicine, there are four basic elements to this practice. The first is formulating a good clinical question, and we'll talk about what this means in a minute. You also need to identify the best available evidence and assess the validity of the evidence, and we'll talk about validity of medical literature evidence in a minute. And then lastly, you need to apply the evidence from the literature in practice to a specific patient. So the cornerstone of evidence-based medicine is the formulation of good clinical questions. So a clinical question is something that can be answered from the medical literature. For example, which diagnostic test should I use on my patient? Or which drug should I use to treat my patient? And if you want to practice evidence-based medicine, you need to formulate good clinical questions. And a good clinical question should be focused and answerable using research from the medical literature. And the popular way to define a good clinical question is through what's known as the PICO model. So PICO is a mnemonic that stands for the elements of this model, which can be used to formulate good clinical questions. The P is for what is the patient population your question pertains to. The I is for what is the intervention being considered. The C is for what is the comparison intervention or population. And then finally the O is for what outcomes are important. So the reason the PICO model is encouraged in practicing evidence-based medicine is because it helps you form good clinical questions and avoid bad clinical questions. So for example, do ACE inhibitors work for hypertension is an example of a bad clinical question. First of all, it's very vague. Which ACE inhibitor are you talking about? And what does the word work mean in terms of hypertension? There's also no population defined. Are you talking about older patients or younger patients or patients who smoke or patients with diabetes? And then finally, there's no specific outcome. The question just asks, do ACE inhibitors work? Well, what does that mean, do they work? Does that mean, do they lower blood pressure, or does that mean, do they prevent strokes or myocardial infarctions? On this slide, I've reworded that bad clinical question to make it into a good clinical question. This is something you can very easily go to the medical literature to answer. So among obese adult women with hypertension, is lisinopril more effective than hydrochlorothiazide for the prevention of heart disease? So if you go back to the PICO model, we've defined our population very narrowly. It's obese adult women that we're interested in. We've also specifically defined our intervention as the drug lisinopril, not just ACE inhibitors in general. We also have a very specific comparison, that's patients taking hydrochlorothiazide. And then we've also very specifically defined the outcome of interest. We're interested in preventing the onset of heart disease with the drug lisinopril. So on your board exams, they'll want you to be able to identify a good clinical question and know that this is the type of question you can easily go to the medical literature to find an answer for. When you go to the medical literature to answer a clinical question, you need to understand the different types of evidence that you will encounter. Primary resources are generally the first available pieces of evidence about a clinical problem, like whether or not a drug works, or whether a diagnostic test works, or whether an exposure is associated with disease. Primary resources include things like case reports and case series, or observational studies like cohort and case control studies, or randomized clinical trials about new drugs and new treatments. And in general, randomized clinical trials tend to be the best evidence that we have. They're usually the strongest and most reliable type of evidence that a particular intervention works for patients. And so usually the first things available and published in the medical literature are primary resources. These are often written by the investigators who actually did the research, and they're publishing the first reports and the first evidence that a certain intervention works or that a certain association between exposure and disease exists. After a number of primary resources have been developed about a topic in medicine, you will then start to find in the literature systematic reviews and meta-analyses. These are compilations of primary studies where the authors are trying to pool together the data from different primary studies and draw stronger conclusions. These are often written by investigators who did not do the primary resource evaluation. These are secondary authors who are pooling the evidence together and trying to draw stronger conclusions. And then finally, after an element of clinical care, like a drug or a diagnostic test, has been around for a long time, the last thing that becomes available in terms of evidence are society guidelines. These are written based on multiple sources. They pull information from primary data and systematic reviews. They also pull information from clinical expertise and patient preferences, and they try to come up with guidelines for providers as far as what to do in terms of diagnosis and treatment. So just to give you an example of this, when beta blockers were first studied for patients with heart failure, initially primary resources were found in the literature. These were observational studies or randomized clinical trials. Now that beta blockers have been used for decades treating heart failure patients, we have guidelines from the American Heart Association and other groups telling us when to use beta blockers and how to use them. You can also think of the types of evidence found in the medical literature as occurring along a spectrum, starting with pieces of evidence that are relatively weaker in general and that may contain more bias, all the way to pieces of evidence that are stronger and have less bias. So in terms of patient care, the weakest piece of evidence you can have in support of an intervention or an association is animal research. There are lots of examples of things that occur in animals, but we don't find the same phenomena occurring in humans. Observational studies that involve human subjects are generally stronger pieces of evidence than animal research. So this includes things like case reports and case series and case control studies and cohort studies. And I talk about all these things in other videos, but in those videos I mentioned that cohort studies are generally the strongest form of observational studies. Case reports and case series are generally the weakest, and case control studies are in the middle. And then the strongest pieces of evidence you can find in medicine for interventions like drugs or surgeries come from experimental trials. So a randomized controlled trial is a very powerful piece of evidence supporting an intervention to help patients. Once there are a number of randomized controlled trials on an intervention, you then start to see systematic randomized controlled trial reviews and also meta-analyses of randomized controlled trials. All of these things represent clinical research evidence, and in general, they are the strongest pieces of evidence that we have, and they usually have the least amount of bias. Now let's imagine that you've formed a good clinical question and you've found a research study from the clinical literature. How are you going to evaluate that piece of evidence to decide whether you should use it to take care of patients? Well, the first thing you want to do when evaluating something from the clinical literature is assess the internal validity of the study. Internal validity basically means, was the research conducted properly and are the conclusions that the researchers drawn correct? So when you're assessing internal validity, you're looking at things like, how did they recruit the patients? Was there any bias when the patients were recruited or when the outcomes were assessed? And is there any possibility that the results are due to chance and not due to a real phenomena that exists in reality among patients? And so this is the first thing to do when evaluating a piece of evidence, is assess the internal validity and make sure there are no errors in the way the research was conducted. The second thing you do is assess the external validity of a piece of evidence. This means, does the research apply to patients not in the study, including your own patients? When you're assessing external validity, you ask questions like, are the study patients similar to real-world patients? Is the intervention in the study similar to real-world interventions? The study may have been conducted very well and may have strong internal validity, but studies can lack external validity if there are problems applying the findings and the results to patients in the real world. So when you're assessing the external validity, basically you're asking yourself, does this study and the findings in the study apply to the patient in my clinical question? And then the last thing to know about evidence-based medicine is that you also have to take into account your own clinical expertise and the patient's wishes. So when I'm taking care of patients with heart conditions, I need to know what the best evidence is in the literature. But then I also have to factor in my own clinical expertise and things that I have learned over the years about whether or not a certain intervention or a certain diagnostic test will apply to a particular patient. And then also you have to take into account the patient's wishes. Just because we have evidence that a particular intervention works doesn't mean that intervention is in line with the patient's wishes. So once you have a clinical question and you know the best evidence for taking care of your patient, you then factor in your own clinical expertise and the patient's wishes, and that represents the process of using evidence-based medicine to take care of patients. And that concludes our module on evidence-based medicine.